Welcome to Kentucky Crossroads with Roger Ford. Here, you'll find a lively discussion about the issues, unique communities, and fascinating people from across the Bluegrass State. Each week, we'll discuss our history and culture, as well as explore the unique places that make Kentucky so special. Now, join our host Roger Ford as we take a journey through the Bluegrass State and discover the stories that make us so unique.
Welcome to Kentucky Crossroads. I'm Roger Ford. Today we'll be discussing certificates of need and their impact on our Commonwealth. These certificates of need are also known by the acronym CON. CONs is a regulatory process used to determine whether new or expanded healthcare services are needed in a particular region of the state. While the idea behind a certificate of need is to control healthcare costs and ensure that patients have access to high quality care, it has become a very controversial issue in many states, including our own here in Kentucky. On one hand, proponents of certificates of need argue that it helps prevent unnecessary duplication of medical services, which can drive up healthcare costs. By requiring providers to obtain a certificate of need before establishing a new facility or adding certain medical services, CONs can help ensure that healthcare resources are allocated efficiently and effectively. Now, the question that obviously comes to mind at first is that if this is the case, why do our healthcare costs continue to escalate? And albeit it's not just simply the certificate of need causing that, but the argument that the certificate of need can help control healthcare costs and those escalating things within healthcare, that they can keep that under control obviously doesn't really bear out if you look at the financial data. Additionally, they argue that certificates of need can promote the delivery of high quality healthcare services, as providers must demonstrate that they have the resources and expertise to deliver quality health care. Now, on the other hand, critics of certificates of need argue that it can stifle competition and limit patient choice. Some argue that certificate of need laws give established healthcare providers an unfair advantage, as those providers currently in the market make it very difficult for new providers to enter that market. Additionally, opponents of certificate of need claim that it can lead to decreased innovation and quality of healthcare, as providers have less incentive to invest in new technologies or procedures if they do not face competition from other providers. I would go so far as to say that it also hurts with basically how the business is run itself in response to the public. Maybe they're not as motivated to provide services in a friendly way because they know that they can't be subjected to new competition. And in Kentucky, this debate over certificates of need has been going on for many years, with both sides presenting compelling arguments. Supporters arguing that the CON points to the state's relatively low health care cost, while opponents argue that certificates of need has limited patient access to health care services. Regardless of which side of the debate one falls on, it is clear that certificates of need is a complex and nuanced issue that deserves careful consideration and further study. On Kentucky Crossroads today, I will discuss certificates of need and their impact on rural communities especially, and provide some real-world examples of the need of the certificate of need for the benefit of people in rural Kentucky, especially in the area of ambulance services, which we will find that in rural areas is grossly underserved, leading to needless delays in response times and untimely deaths. So let's really get to the core of this. First, let's start with what is a certificate of need. A certificate of need is a legal document issued by a government agency or regulatory body to a healthcare provider, facility, or organization. This certificate is designed to regulate the healthcare industry by requiring healthcare providers to obtain approval before opening or expanding healthcare facilities, purchasing certain medical equipment, or adding certain healthcare services. Supporters of this process that's currently in place say it's intended to ensure that healthcare providers use resources efficiently, to prevent the overuse of healthcare services, and to avoid unnecessary duplication of services. The purpose of this regulatory mechanism is to balance the need for quality healthcare with the financial realities of the healthcare industry. The requirement for obtaining a certificate of need vary depending on the jurisdiction and the specific healthcare service or facility in question. Generally, the process involves a detailed application that includes information on the provider's experience, the proposed project, the need for the project, the impact of the project on the community and other healthcare providers, and the overall cost of the project. The regulatory body reviews the application and determines whether the proposed project meets the requirements for a certificate of need. If that application is approved, the provider is granted a certificate of need which authorizes that project or service to proceed. If the application is denied, the provider may appeal the decision or modify the project to meet the requirements. The use of certificates of need has been controversial, with some arguing that they limit, decrease innovation and competition, and they lead to higher healthcare costs. Others are arguing that they are an essential tool for ensuring that the resources are used efficiently and patients receive that good quality care. As such, this use continues in the debate. Such is the case in Kentucky, where existing healthcare providers are given nearly carte blanche say in the process to deny a new healthcare provider from entering a particular market. This includes ambulance services. So, what are state laws in Kentucky and what regulations oversee certificates of need? The set of laws and regulations that require certificates of need in Kentucky can be found in the Kentucky Revised Statutes and Kentucky Administrative Regulations. Specifically, Kentucky's CON program is governed by KRS Chapter 216B and KAR Title 900 Chapter 6. KRS Chapter 216B establishes the framework for Kentucky's Certificate of Need program and outlines the types of healthcare facilities, equipment, and services that are subject to Certificate of Need review. Among these are included acute care hospitals, long-term care facilities, hospital and hospice facilities, ambulatory surgical centers, diagnostic imaging facilities, open heart surgery programs, radiation therapy facilities, comprehensive outpatient rehab facilities, home health agencies, end-stage renal disease facilities, neonatal intensive care units, and psychiatric residential treatment facilities. Kentucky Revised Statute Chapter 216B also establishes the criteria that must be met in order for a healthcare provider to obtain a certificate of need, including demonstrating the proposed project is necessary to meet the healthcare needs of the community and will not result in unnecessary duplication of services. In addition to that, we have the administrative regulations that are covered under Title 900 of the Kentucky Administrative Regulatory Code. Chapter 6 provides that more detailed regulations for Kentucky's Certificate of Need program, including the application process, review procedures, requirements for maintaining a certificate of need, are all met. And it also outlines the circumstances under which a certificate of need may be revoked, suspended, or modified. Together with KRS Chapter 216B and KAR Title 900 Chapter 6, this forms the legal framework for Kentucky's Certificate of Need program. And healthcare providers operating in Kentucky must comply with these laws and regulations if they wish to establish or expand healthcare facilities, equipment, or services in the state, anywhere from Pikeville to Paducah. So I guess the question then becomes, yes, certificates of need are required for ambulance services in Kentucky as well. The Certificate of Need program is administered by the Kentucky Cabinet for Health and Family Services and it requires ambulance companies to obtain a certificate of need before they can provide non-emergency medical transportation services in the state. Under Kentucky law, a certificate of need is required for any new or expanded healthcare facility or service, including ambulance services. The certificate of need process is designed as of today to ensure healthcare services are provided in an efficient, cost-effective manner and to prevent unnecessary duplication that proponents say could drive up healthcare costs. Ambulance companies in Kentucky must demonstrate that there is a need for their services in the area where they plan to operate, and that their services will be of a high quality and will be provided at a reasonable cost. Once a certificate of need is granted, the ambulance company must comply with all other state regulations and standards for an ambulance services, including staffing requirements, equipment standards, training requirements for emergency medical techs and paramedics. So this leads us to what efforts have there been over the last couple of decades to reform the certificate of need process in Kentucky? Well, in researching things for today's program, I found that since 2001, the certificate of need process, which regulates the construction, expansion, and acquisition of healthcare facilities and services, has been a very debated topic. And there have been some proposed reforms in the Kentucky General Assembly. After some research on the subject, I've identified a set of bills that were introduced in the General Assembly to reform the Certificate of Need program. I'll list those major proposals here and take note of which ones passed and which ones didn't. Let's begin in 2003 with House Bill 381. This bill sought to repeal the Certificate of Need program entirely. It failed. In 2005, House Bill 386 was a bill aimed to revise the Certificate of Need process, eliminating the need for certificates of need approval for the acquisition of an existing health facility, and also raise the threshold for Certificate of Need requirements from $1 million to $5 million. It did not pass. In 2007, House Bill 311 proposed to establish a new Certificate of Need process for the development of ambulatory surgical centers, as well as raise the minimum investment threshold triggered for Certificate of Need review from $1 million to $3 million. That did not pass. In 2011, House Bill 225 sought to eliminate the Certificate of Need program for all healthcare providers except nursing homes or long-term care facilities. It passed the House, but died in the Senate. In 2016, Senate Bill 20 proposed to streamline the Certificate of Need process by removing the requirement for a public hearing and allowing healthcare providers to appeal the decision of the CON Review Board directly to the courts. It did not pass. In 2018, House Bill 314 aimed to eliminate the Certificate of Need program for all healthcare providers, again, except for nursing home, long-term care facilities, hospice care providers, and so forth. It passed the House, but died in the Senate. In 2019, House Bill 354 sought to repeal the Certificate of Need program, again, entirely. It did not pass. During this period, there has been an effort on the part of several Republican legislators to repeal the CON. Here are some examples of legislators who have expressed support for repealing or reforming the Certificate of Need program in the past. In 2015, State Senator Ralph Alvarado introduced a bill to repeal the CON program, which ultimately did not pass. He has been a vocal critic of the program and has argued that its limit is geared towards stifling competition and driving up healthcare costs. And I would note Senator Alvarado is a medical doctor. So I would kind of defer to him on that as far as guidance. In 2018, State Representative Jim Duplessis introduced a bill to repeal the CON program, citing concerns about the impact healthcare had on healthcare access and affordability. The bill did not advance, meaning it did not pass. In 2019, State Representative Danny Bentley introduced a bill to reform the COM program, which would have eliminated some of the requirements for obtaining a certificate and made the process more transparent. Again, the bill did not pass. We see a pattern here. In 2020, State Representative Steve Sheldon introduced a bill to repeal the Certificate of Need program, arguing that it was outdated, and it stifled competition. Again, making the argument that it interferes with competition entering the market, mainly from existing providers. That bill also did not advance. In 2022, State Senator Whitney Westerfield sponsored a bill to repeal the Certificate of Need program, which passed the Senate, but ultimately did not become law. We see a pattern here, folks, among that recounting of these various bills, none of which of these have passed. So how do we improve healthcare services within the current framework and the Certificate of Need? Well, I would say that for especially rural areas, that improving healthcare means greatly curtailing or an outright repeal of the Certificate of Need, especially when it comes to things like ambulance services. So, on the topic of that, ambulance services in rural Kentucky, it may require a multi-pronged approach that involves a combination of policy solutions. Some of these potential policy solutions that could help improve ambulance services in Kentucky are among the following: increase funding for rural ambulance service. Rural areas do not have the same tax base as urban areas, which can limit the amount of funding available for the ambulance service. One solution could be to increase funding for ambulance services through state or federal grants, or by allocating more resources to rural EMS agencies. Two, one which I greatly favor is expanding telemedicine services that can be especially valuable in rural areas where there may be limited access to healthcare providers. By expanding telemedicine services, ambulance crews can consult doctors and other healthcare professionals to better manage patients in the field and provide more effective and immediate care. Three, provide training and certification for EMTs and paramedics that is improved and can vary widely from state to state. And there may be a shortage of qualified EMS providers in the rural area. And by doing this, by making our training more capable of crossing state boundaries, we provide better qualified EMS providers in rural areas as people move from one place to the other. Providing more training opportunities and incentives for EMS providers to work in rural areas could address a major problem. Number four, we could increase community engagement and education. Many rural communities don't fully understand the importance of having ambulance service in close proximity to the community, or the role that EMS providers play in their community. Increasing public engagement and community education could help to raise awareness and support for ambulance service, as well as promote healthier lifestyles that could reduce the need for emergency services in the first place. We can implement a community paramedicine program. What is that? That is a program designed to provide non-emergency medical care in the community, which can reduce the demand for emergency ambulance services. By providing preventative care and managing chronic conditions, community paramedicine programs that could be coupled with telemedicine could help improve the health of rural residents and reduce the need for emergency services. But we go back to the main point. All of this is a short-term fix unless we do something about the Certificate of Need process. So how can reforming or repealing certificates of need lead to better health care in rural Kentucky? In Kentucky, there is an increasing debate over whether to repeal Certificate of Need laws to improve, among other things, ambulance services. The arguments in favor of repealing certificate of need laws for ambulance services include the following in my research I've found. Number one, increase competition. Repealing these laws would increase competition in the market for ambulance services. Currently, certificate of need laws limit the number of ambulance providers, which reduces competition and does result in higher prices and lower quality services because of the time that it takes to get from, say, Pikeville to Majestic or Pikeville to Elkhorn, as is the case right now in Pike County, Kentucky. That goes back to improved response times. Repealing laws could improve response times for emergency medical services. With more providers competing in the market, there would be a greater incentive to invest in new equipment and technology, hire additional staff, and improve response times, which would include building ambulance stations within more remote areas of eastern Kentucky, such as Elkhorn City, that's been plagued by this, and Phelps and Majestic, that also have this problem as remote areas of our county. Number three, increased access to service. Repealing these laws would increase access to ambulance service in rural and underserved areas. Currently, those laws limit the number of ambulance providers in these areas. This results, as we all know, in longer wait times and reduced access to emergency medical services. We could also see a cost savings. Repealing these laws could result in cost savings for consumers and for insurers. With more competition, ambulance providers would be incentivized to reduce cost and improve efficiency to stay competitive. And the upside is always a component of that, patient choice. Repealing certificate of need laws would give patients more choice in selecting their ambulance provider. Currently, CON laws limit the number of providers, which limit patient choice and force patients to use a provider they may not prefer. Again, freedom of choice, free in the market, open competition, all of these things can help drive down, but we first must address the repeal of the certificate of need in order to be able to do this effectively, or drastically reform the system so that current providers can't block new providers from coming into an area like Elkhorn City or Phelps or Majestic or some of these other very, very remote areas of our region of the state, which ends up costing insurers more and possibly costing the patient their life. So, in closing today, we've been discussing the certificate of need and what we might do to reform that. And from my perspective, this issue needs greater focus from our political leaders, especially as it impacts rural communities in eastern Kentucky. Many of the communities, for example, that I've mentioned, Elkhorn City and Phelps, are burdened with the lack of ambulance services. I personally know several instances where individuals requiring immediate need have died waiting on an ambulance to arrive, sometimes taking up to 2 hours to reach their home, just to get them to the hospital. In the United States, this is an outrage, and something must be done. Of late, Pike County Judge-Executive Ray Jones has scheduled a meeting in the Phelps community to address a lack of ambulance service, which is lacking due to certificate of need preventing new ambulance services in that community. Current ambulance services have too great a say in whether a new service can be established. Frankly, it's un-American to limit competition in a free market in such a way that it puts the health of our fellow citizens at risk. And while I applaud Mr. Jones for running around as though he's trying to help the community, he's had over 20 years to effect a positive change when he was in Frankfort as our state senator, part of which he served as minority leader, and he failed. He failed to introduce good legislation. He failed to work with those in the majority to reform the system and repeal certificates of need. And my question is, why now? Why is he trying to act now on an issue that needs attention from Frankfort when he could have acted sooner when he was in Frankfurt? And only he can answer those questions. While we wait, I can only venture the guess that he does so to try for some political posturing. It is clearly evident that remote communities in eastern Kentucky need the same access. Nay, they deserve the same access to healthcare services as more urbanized areas. Certificates of need must be repealed. They must be drastically reformed at best. And it's decades past time that they get attention so that our people get equal access. How many more lives must be needlessly lost due to delayed response from emergency providers, from those in Frankfurt who repealed the certificate of need? Talk to your legislators, talk to your state senator, talk to your state representative. Ask them these questions. Why do we need certificates of need? And why are they stifling competition? And why are they harming the health of so many rural Kentuckians? We're at a crossroads on this issue, and it's time to act. For Kentucky Crossroads, I'm Roger Ford. Until next week, God bless you. God bless your family. God bless our nation and our Commonwealth. Thank you.
You've been listening to Kentucky Crossroads with Roger Ford. Be sure to join us for our next weekly episode, where we'll discuss the issues, history, and culture that makes Kentucky such a unique place in our country. Kentucky Crossroads is broadcast on Southern Classic Radio each week and is available on YouTube, Apple, Spotify, and other podcast platforms. Thanks for listening.